Hello everyone, welcome back to the channel. Today, we're diving into an incredibly important health topic that every man, and their loved ones, should be aware of. We're talking about prostate cancer, one of the most common cancers among men worldwide. The good news is that if caught early, prostate cancer can often be treated successfully. But early detection depends on knowing what warning signs to watch for, signs that might seem subtle but are critical to recognize. In this video, I'm going to share with you the 6 critical early signs of prostate cancer that you need to know now. Understanding these signs could save your life or the life of someone you care about. So please, watch carefully and don't ignore any symptoms that you notice. Brief overview of prostate cancer. Before we get into the signs, let's quickly understand what prostate cancer really is and why it's so important to recognize it early. The prostate is a small gland found only in men. It's roughly the size of a walnut and is located just below the bladder, in front of the rectum. The primary function of the prostate is to produce a fluid that nourishes and transports sperm during ejaculation. Prostate cancer begins when abnormal cells in the prostate gland grow uncontrollably, forming a tumor. Unlike some cancers, prostate cancer often grows very slowly, which means many men may live for years without symptoms. However, in some cases, it can grow quickly and spread to other parts of the body, which makes early detection essential. Here's the challenge. Many men with early-stage prostate cancer don't experience any symptoms at all. That's why it's so important to pay attention to any subtle changes in your urinary or reproductive health. Early signs may be easy to overlook or mistakenly attributed to aging or other less serious conditions. But knowing what to watch for can be the difference between early treatment and a more advanced, difficult-to-treat cancer. Sign number 1. Frequent urination, especially at night. One of the very first signs that prostate cancer might be developing is a sudden increase in how often you need to urinate, especially during the night. This condition is medically known as nocturia. But why does this happen? The prostate gland surrounds the urethra, the tube that carries urine from the bladder out of the body. As the prostate tumor grows, it can press on or narrow the urethra, causing irritation or partial blockage. This pressure interferes with your bladder's ability to hold urine properly, making you feel the urge to go more frequently, even if your bladder isn't full. You might notice you suddenly wake up multiple times a night just to urinate, a change that didn't happen before. This is important because sleep disruption from frequent urination is often one of the first symptoms men experience when something is wrong with their prostate. If you notice this symptom, especially if it comes on gradually and becomes worse over time, it's crucial to schedule a medical checkup. Early intervention can make a huge difference. Sign number 2. Difficulty starting or stopping urination. Another key early symptom of prostate cancer involves your ability to control urination. You might find it hard to start urinating, or once you begin, the urine stream may stop and start intermittently. This happens because the tumor growing in the prostate can partially block or narrow the urethra, making it difficult for urine to pass smoothly. You might feel the need to strain or push to get the urine flowing. Sometimes, even when you feel like your bladder isn't completely empty, the flow can stop suddenly, which can be both uncomfortable and frustrating. It's worth noting that this symptom is often confused with other common conditions like benign prostatic hyperplasia, BPH, which is a non-cancerous enlargement of the prostate, or urinary tract infections. However, if this difficulty persists, worsens, or comes with other symptoms, it is important to get a thorough evaluation by a healthcare professional. Sign number 3. Weak or interrupted urine. Stream closely connected to difficulty starting or stopping urination is the experience of a weak or interrupted urine stream. You may notice that your urine flows more slowly than usual, or instead of a continuous stream, it comes out in spurts or stops and starts several times. This happens because the tumor creates a blockage that reduces the diameter of the urethra, affecting how the urine exits your body. This weak stream might seem like a small annoyance at first, but over time, it can signal a serious underlying issue that needs to be addressed. Even though a weak urine stream can also be caused by other non-cancerous prostate conditions, persistent or worsening changes should never be ignored. Early medical assessment can help differentiate between benign causes and cancer, leading to earlier treatment and better outcomes. Sign number 4. Pain or burning sensation. During urination or ejaculation. Pain or discomfort is one of the body's most important warning signals. When something isn't right, it's telling us to pay attention. With prostate cancer, some men experience a burning sensation or pain either when urinating or during ejaculation. This happens because the tumor inside the prostate can cause inflammation or irritation to the surrounding tissues and nerves. The prostate gland is closely connected to the urinary tract and reproductive system, so any abnormal growth or swelling can trigger these uncomfortable sensations. Pain during urination, medically called dysuria, can sometimes feel like a sharp, stinging, or burning sensation. Pain during ejaculation may be less common, but can also indicate irritation caused by prostate cancer or secondary infections. While these symptoms could also be caused by urinary tract infections, prostatitis, inflammation of the prostate, or other benign conditions, it is very important not to ignore them. Persistent or worsening pain or burning sensations should always prompt a visit to a healthcare professional for proper diagnosis and timely treatment. Sign number 5. Blood in urine or semen. One of the more alarming and unmistakable signs that something serious might be happening in the prostate is blood in the urine or semen. In medical terms, blood in the urine is called hematuria, and blood in the semen is known as hematospermia. Sometimes this blood is visible. You might notice a reddish or pinkish tint. Other times, the blood is microscopic and only detected through laboratory testing. Why does blood appear? The growing tumor can damage delicate blood vessels within or around the prostate gland, causing bleeding. The blood then mixes with urine or semen during urination or ejaculation. It is critical to emphasize that any presence of blood should never be ignored, even if it appears only once. While blood in urine or semen can be caused by other less serious issues, such as infections or injury, it is always a red flag that requires immediate medical evaluation. Early investigation can help detect prostate cancer or other serious conditions before they progress. Sign number 6. Persistent pain in lower back, hips, or pelvis. The final early sign we will discuss is persistent pain in the lower back, hips, or pelvis. This symptom is often associated with more advanced prostate cancer, but can sometimes be noticed earlier. Prostate cancer has a tendency to spread or metastasize to nearby bones, particularly those in the lower spine, pelvis, and hips. When cancer cells invade the bones, they cause pain that is often dull, persistent, and sometimes worsens at night or with movement. It's important to recognize that lower back or pelvic pain can have many causes, including muscle strain, arthritis, or nerve problems. However, when this pain is chronic, unexplained, and occurs alongside urinary symptoms like difficulty urinating or blood in urine, it becomes a warning sign that needs urgent attention. Ignoring this pain or attributing it only to aging or general aches can delay a cancer diagnosis, reducing treatment options and chances of success. If you experience this kind of persistent pain, please consult your doctor immediately for a comprehensive evaluation. Now that you know the 6 critical early signs of prostate cancer, remember this: early detection is key. If you or someone you love notices any of these symptoms, whether it's frequent urination, difficulty starting or stopping urination, pain, blood in urine or semen, or persistent pain in the lower back or pelvis, don't wait or ignore them. Make an appointment with a healthcare professional as soon as possible for a thorough evaluation. Prostate cancer caught early can often be treated successfully, giving you the best chance for a healthy future. Also, regular checkups and screenings become even more important as men age, especially after 50, or if there's a family history of prostate cancer. Thank you so much for watching this video. If you found this information helpful, please give it a thumbs up and share it with family and friends. You never know who might need to hear this today. Don't forget to subscribe and hit the notification bell so you won't miss our future health videos designed to help you live your best life at every age. Stay informed, stay healthy, and I'll see you in the next video.